Sudden cardiac arrest, or SCA, is the leading cause of death among Americans.
Sudden cardiac arrest happens to 350,000 or more adults in the United States each year and to at least 500 to 1,000 children and adolescents. In the school setting, sudden cardiac arrest could happen to a student, a co-worker, a parent, or a visitor. It is important that everyone, adults and teens, learn the early warning signs and how to recognize and respond to a cardiac emergency.
Well, there are a number of different causes of sudden cardiac arrest. They can be structural causes, they can be genetic causes or inherited causes, or finally they can be situational circumstances that impact the heart. An example of a structural defect would be if the heart itself is very thick, a condition that we call hypertrophic cardiomyopathy. Some children have inherited types of heart abnormalities. An example would be congenital long QT syndrome. And in that circumstance, as many as 50% of family members may also have the condition. And sometimes situational circumstances can lead to the heart arresting. An example would be if the heart was hit by a very hard object like a baseball or a hockey puck. That condition we call commotio cordis. And sometimes the heart can be affected by medications or by illegal drug use, especially amphetamines or cocaine, the drugs that speed the heart up. Those can impact the heart. So overall, there are a number of different causes of sudden cardiac arrest, and it's important for family members and children to seek medical attention if they suspect they may have a congenital or an inherited condition.
Many individuals have cardiac abnormalities that go undiagnosed. That's why it's so important to learn the signs and symptoms of a sudden cardiac arrest. Be suspicious if you notice fainting during exercise, unusual shortness of breath, profuse sweating, extreme fatigue or loss of muscle control, or complaints of chest pain or discomfort during exercise. Parents, teachers, athletic coaches, trainers, and Phy-Ed teachers should be especially alert of these signs and symptoms.
Sudden cardiac arrest doesn't always occur with sports. It's often that it does because this is the most intense time, the time that the heart is working the hardest and the time that it puts the largest strain on the heart. Some of the kids actually do have symptoms, and either they don't know it or they don't admit to those symptoms. Some of the other defects can be detected by screening, either by knowing the family history, by pediatricians, family doctors, coaches, teachers, parents being aware of the symptoms. So in those cases, there can be the potential to discover them before something happens. Unfortunately, there is a large subset of the kids who we will not know about the cardiac defect until something bad does happen.
Electrical impulses in your heart trigger rhythmic contractions that circulate blood through your body. Conditions can occur that result in chaotic heart activity known as ventricular fibrillation. When this happens, oxygenated blood stops flowing to the brain and other vital organs. The victim rapidly loses consciousness. Ventricular fibrillation is the most common cause of sudden cardiac arrest. The treatment for ventricular fibrillation is defibrillation, an electrical shock delivered through the heart using a device called a defibrillator, or AED. Unfortunately, some victims may not exhibit any symptoms before the sudden cardiac arrest occurs.
Not all episodes of sudden cardiac death are preventable because many of the kids do not have symptoms until they have the episode of sudden death. Therefore, it's been our feeling that we need to be in a position where we can intervene rapidly and effectively.
That is why it is important to be prepared to respond quickly when a cardiac emergency occurs. These rescuers saved precious time until trained medical personnel could arrive. When a sudden cardiac arrest occurs, every second counts. A victim's chances of survival are reduced by 7 to 10% with every minute that passes without CPR and defibrillation. For that very reason, it is important that your emergency response plan includes CPR training and AED practice drills. They should be done throughout the year. The team should strive for consistent improvement in response times. It's a fact. School emergency response team members trained in CPR and the use of an AED save lives. Milwaukee Public Schools safety assistant Harold Smith found out how important this training is when a coworker collapsed in front of him.
He wasn't breathing, so I called for assistance. She arrived with the defibrillator. We put the pads on him, shocked him back to life. I had just 2 weeks prior to that, I had took CPR and defibrillator training. So I applied both the CPR and the defibrillator training to him.
Because of his quick reaction, Harold's friend is alive today.
He thanked me every day, and a life is saved, thanks to the training that I received.
Implementing an active defibrillation program at school, along with adequate training, can make the difference between life and death for our children.